Hi, I'm Dr. Mangesh Kamath. I'm a senior consultant, medical oncologist, hemato-oncologist, and bone marrow transplant physician practicing at Helios Cancer Hematology Clinics, Bangalore. Colon cancer. More than 1 million cases of colon and rectal cancers are diagnosed every year across the world. India has a huge burden of colorectal cancers. And it is very important that we are aware of colorectal cancers so that we can prevent and also treat it in a more efficient way. So what causes colon cancer? Lack of regular physical activity, obesity, a diet low in fruits and vegetables, lots of processed food, lots of processed meat, alcohol consumption, tobacco use are some of the most common acquired causes of colon cancer. Of course, there are also the genetic risk factors for colon cancer, familial adenopolyposis coli, then hereditary non-polyposis colon cancers are also something which are also seen very regularly in our practice. So these are the causes for colon cancer. So what are the symptoms of colon cancer? Colorectal cancer symptoms depend on the size and the location of the cancer. For example, if you have the tumor located in the rectum, you will feel a lot of changes in bowel habits. There could be blood in stools and lots of cramping like sensation before have to pass stools. However, if you have the tumor in the ascending colon, in those cases, we see severe constipation. In the left side of the colon, you can see increased diarrhea as well. So the most common symptom that we usually see in practice is a sudden and a change that is not related to any diet or exercise, change in bowel habits. If the bowel habits change, like you get alternating constipation, diarrhea, or you get prolonged constipation, or you get increased frequency of passing stools, blood in stools, and abdominal discomfort, these are some of the symptoms which probably indicate to us that something more than just infection is causing these symptoms. So at this time, we go and investigate for a colon cancer. Sometimes patients also come to us with weakness because of anemia. So because you are passing a lot of blood in stools, patient develops anemia, and due to anemia, patient develops fatigue. So the patient comes to you. Then weight loss. Many a times weight loss is also the reason. Again, because patient, to avoid constipation or to increase diarrhea, patient avoids eating a lot of food, and sometimes just because of the growing tumor, and even if the tumor has spread to other organs, it can give rise to patient losing weight due to the cancer per se. So how do we prevent colon cancer? Now, these are very important questions asked by not only the relatives of patients who have developed colon cancer, but also the general public as well, because the general public knows that colon cancers are very common in the world. So one of the major ways of preventing colon cancer is by going the healthy route. So increasing physical activity, keeping a healthy weight, keeping yourself very active by exercise, or generally being very active and fit. Then limiting alcohol consumption, avoiding tobacco, and if you have a close relative who has got colon cancer or rectal cancer, then you undergo genetic testing, and if you are detected to have the colon cancer causing genes, then you undergo preventive surgery or preventive measures. So these are some of the most important ways of preventing colon cancer. So just to summarize, be fit, avoid processed food, have a diet rich in fruits and vegetables, and make sure that your tobacco and alcohol consumption are avoided. And even if you are a social drinker, keep it to a limit. These are the most important and easy ways of preventing colon cancer. So the treatment of colorectal cancer depends on the size of the tumor, the location of the tumor in the large bowel, then whether the cancer has spread to other organs or not. So it is a very elaborate process. So to make sure that we treat colon and colorectal cancers in an efficient way, we make sure that we have the histopathological diagnosis. That is, we do a biopsy of the tumor and find out what are the characteristics of the tumor. The second thing is we do a colorectal scopy to make sure that we identify if there is only one tumor in the large bowel or multiple tumors or polyps in the large bowel. So we do a colonoscopy, sigmoid rectoscopy, and so on. After that, we do a PET CT scan or a whole body CT scan to make sure that we see whether the tumor is locally advanced. That means the tumor has started here and it's gone and spread to the nearby areas, or it has spread to other organs such as liver and lungs. So based on this, we get to know the stage of the tumor. And if the patient is detected to have early stage of colorectal cancer, the most important way of discussing the best way of treatment is by a multidisciplinary tumor board. That means a medical oncologist like me, a surgical oncologist, and a radiation oncologist, if it is a rectal tumor, are involved in the decision making before starting the treatment. So a surgery is done for both colon cancers and rectal cancers. So a surgery is a very important part of the treatment of the cancer. And two, medications, chemotherapy or targeted therapy, if there is the advanced cancer, are very important in treatment of the colon cancer. And if the tumor is in the rectum or just before the outlet of the stools into the anus, in that region, if the tumor is located, in that case, we go for a tri-modality treatment in which initially we give chemotherapy and radiotherapy to the patient, shrink the tumor to as small as possible, and then take the patient for surgery. So multidisciplinary stage, the treatment method is followed for patients so that we can give them the ideal treatment for colon cancer and rectal cancer. So folks, please remember, only a qualified medical oncologist or surgical oncologist or radiation oncologist is going to be an expert enough to make sure that if you have colon or rectal cancer in the early stage, they will be the most important decision makers so that you are cured of the cancer. And there are no other proven alternatives to modern medicine in the treatment of colorectal cancers. So make sure that you are diagnosed early, you are treated early, so that you can get the benefit of being cured from colorectal cancer. Thank you.